Are you taking Ozempic for diabetes or weight loss or any other indication? Ozempic and those medications in that category are super popular right now. It seems especially in Hollywood, but for us as anaesthetists, they have some pretty serious implications. Why? Because they can leave your stomach full of food, and that puts you at risk of regurgitation and aspiration. And they're just basically fancy words for food coming up from your stomach and then going down into your lungs. And that can cause some pretty nasty reactions. Your lungs were not designed to have food and stomach acid in them. So if you're scheduled for surgery soon or a procedure where you're likely to have an anaesthetic, then it's really important that you tell your anaesthetist if you're on these medications. What advice they give you is going to really depend. It's going to depend on the type of surgery or procedure that you're having, the type of anaesthetic that's planned, how long you've been on these medications, what you're taking them for, if you're getting any stomach-related symptoms, especially food-related symptoms. So they might ask you all those sorts of questions to help try and plan the best path forward. And then based on that, there's 6 possible things that might happen. So one is that we might ask you to have what's called a prolonged fast. So usually prior to surgery, we don't want you to eat anything for 6 hours before your anaesthetic. And we might ask you to extend that for 12 hours, even 24 hours. The other thing that we could do is an ultrasound of your stomach to see if it's full. We might also give you some medications to try and empty your stomach. Depending on the medication, particularly the shorter acting ones, we might ask you to withhold or skip a few doses. There's something we can do on our end to modify the anaesthetic. That can be quite a significant modification. It's not just a matter of changing one medication for another, but potentially it means changing our whole anaesthetic technique. And the final thing we might consider is deferring your surgery or procedure that day. We might ask you to come back on another day when it's safer for you to go ahead. Obviously, that's something we don't enjoy doing, so it's really important, if you can, to speak to your surgeon, your proceduralist, whoever's booking the procedure for you, and your anaesthetist as soon as possible. Tell them that you're on these medications. So clearly, this is general advice. I've mentioned Ozempic by name. It's not just Ozempic, it's all the medicines that are in that family that this applies to. And you really need to speak to your anaesthetist about getting some specific advice for you. If you want to know more about why fasting or having an empty tummy before you have your anesthetic is really important, then I invite you to have a look at the ASA website for more information.